Infections that are far more dangerous than coronavirus. Hello guys, we know what's going on in the world and notice that the population that goes by is panicking. We want to show you something worth knowing because we care about how well you're informed. Make sure you listen well to what is said in this video. This can completely change your fear for the current coronavirus COVID-19. The whole history of mankind is life side by side with bacteria, parasites, and viruses. They cause infectious diseases, that is, transmitted through contacts of various kinds. Through the blood, like HIV, hepatitis B and C, with insect bites, like malaria, by airborne droplets, like flu, tuberculosis, and measles. Since the end of last year, a new type of coronavirus, COVID-19, joined the group of the latter. The lack of knowledge, and therefore the weak predictability of the new enemy, is understandably alarming. It is important that it does not panic, since stress itself affects the immune system. Because of this, our basic defense against infections is weakened. In order to be less nervous, experts advise, firstly, to take preventative measures, observe hygiene rules, be in less crowded places. Secondly, to face the facts. In fact, we have long been cohabitating with infections that take comparably more lives than coronavirus. Coronavirus pandemic in the end of March 2020. According to the World Health Organization, the number of people infected with the new coronavirus in the world exceeded 267,000. The leader in the number of confirmed cases, according to the South China Monitoring Post, remains China at 81,054. In second place is Italy with 53,578. In third is Spain with 24,926. The U.S. publications put in fourth place, but scientists at Johns Hopkins claim that there are more than 26,000 infected, and thus the country is in third place. The most dead from the coronavirus is in Italy with 4,825, China with 3,261, and Iran 1,556. All in the world died of coronavirus, according to the World Health Organization, is 11,201 people. And now let's see what diseases annually take tens, hundreds, and thousands of times more lives on the planet. But for some reason, there's no panic. Flu. The influenza virus causes a person to have a sharp increase in temperature, pain throughout the body, photophobia, sometimes sore throat, and runny nose. Complications from influenza occur very often in unvaccinated people. They can affect the cardiovascular, nervous systems of the body, cause otitis media, sinusitis, pneumonia, encephalitis, meningitis, sepsis, and other diseases. According to new estimates from the United States Centers for Disease Control and Prevention, the World Health Organization, and global health partners, up to 650,000 people die of respiratory illnesses caused by seasonal flu every year. Malaria. Malaria, from Italian malaria, bad air, formerly known as swamp fever, a group of vector-borne infectious diseases transmitted to humans by biting female Anopheles mosquitoes of malaria mosquitoes, is caused by parasitic protists of the genus Plasmodium. Malaria is accompanied by fever, chills, splenomegaly, an increase in the size of the spleen, hepatomegaly, an increase in the size of the liver, and anemia. It is characterized by a chronic, relapsing course. At the beginning of the 21st century, the incidence was 350 to 500 million cases a year, of which 1.3 to 3 million ended in death. Mortality was expected to double in the next 20 years. According to the latest World Health Organization estimates, from 124 to 283 million cases of infection with malarial plasmodia, and from 367,000 to 755,000 deaths from the disease occur annually. For 2019, the effectiveness of the existing Plasmodium malaria vaccine is low at only 31 to 56%. HIV and AIDS. The human immunodeficiency virus, HIV, infects the cells of the immune system, destroying or disrupting its functions. Virus infection leads to progressive degradation of the immune system and, as a result, to immunodeficiency. The immune system is considered defective when it can no longer fulfill its role in the fight against infections and diseases. Infections associated with severe immunodeficiency are known as opportunistic infections, since they take advantage of the capabilities of a weakened immune system. HIV remains one of the main problems of global public health. To date, the virus has claimed more than 32 million human lives. However, by expanding access to effective means of preventing, diagnosing, and treating HIV and opportunistic infections, as well as caring for patients, HIV infection has moved into a category of treatable chronic diseases, and HIV-infected people can live longer and healthy lives. Every day, 7,400 new HIV-infected people appear in the world, and 5,500 people die from diseases caused by HIV. Every hour in the world, 308 people become infected with HIV. Cancer. Cancer is one of the leading causes of death in the world. In 2018, according to the World Health Organization, 9.6 million people died from oncology. The most common types of cancer were lung cancer, 2.09 million cases, breast cancer, 2.09 million cases, colorectal cancer, 1.8 million cases, prostate cancer, 1.28 million cases, skin cancer, 1.04 million cases, and stomach cancer at 1.03 million cases. In this case, early diagnosis is considered as the most important way to fight cancer. According to the World Health Organization, an average of 300,000 oncological diseases in children are detected annually. In developed countries, 80% of children beat cancer, while in low and middle income countries, this level is only 20%. The largest number of annual deaths from cancer occurs from cancer of the lungs, stomach, liver, colon, and breast. Tobacco use is by far the single largest cancer risk factor, which accounts for over 20% of global cancer deaths and about 70% of global lung cancer deaths. Rotavirus. Rotavirus infection is an infectious disease caused by rotaviruses. It is the most common cause of diarrhea in children. This disease is characterized by an acute onset mild symptoms of gastroenteritis or enteritis, a frequent combination of intestinal and respiratory syndromes in the initial period of the disease. Rotavirus infection is often incorrectly called intestinal flu, although rotavirus has nothing to do with influenza viruses. Rotavirus is widespread in the world. Up to 25 million cases of the disease are recorded annually, 600 to 900,000 of which end in death. Measles. Measles is an acute infectious viral disease with a very high level of infectivity, which is characterized by high temperature up to 40.5 degrees Celsius, inflammation of the mucous membranes of the oral cavity and upper respiratory tract, conjunctivitis, and a characteristic spotty papular rash of the skin, general intoxication. According to the World Health Organization, in 2017, around 110,000 people died from the measles. In the world, 92,000 of them were under the age of children of 5. Measles remains one of the leading causes of child mortality in developing countries, at 1.3% of child mortality in 2016. Tuberculosis, the killer of millions. Tuberculosis is among the 10 most dangerous diseases, which account for the largest number of deaths worldwide. Among infectious diseases, those caused by bacteria and viruses, unlike, for example, cancer or heart attack, he is the undisputed leader, killing more than 1 million patients every year. The causative agent of the disease is a bacterium known as Cox bacillus. According to the World Health Organization, every fourth inhabitant of the planet is its carrier, which means that in theory, the disease can manifest itself at any time. According to the latest report in 2018, tuberculosis claimed an average of 4,000 lives every day, causing 1.5 million deaths. Moreover, the total number of cases during the year increased by about 10 million people. This is comparable with the population of Sweden, Portugal, or Azerbaijan. The good news is that both of these indicators continue to fall. Since the beginning of the century, mortality from tuberculosis worldwide has fallen by more than 1.5 times. 2/3 of all new cases occur in 8 countries: Bangladesh, India, Indonesia, China, Nigeria, Pakistan, the Philippines, and South Africa, which is not surprising since half the world's population lives in them. Methods to combat these diseases are tested and safe. However, the world is still in no hurry to do these real necessary vaccinations. Express your opinion in the comments, share the video with your friends to prevent panic, and rate our video. Be sure to subscribe and activate the bell, the most interesting videos with us. Regular updates and top quality content. Thanks.